Hello, everyone. Our group is representing San Joaquin Delta College. We are third semester nursing students, and we are going to be presenting on valley fever today. My name is Daniel Kang.
My name is Mario Ballesteros.
My name is Evan Alvarez.
I'm Francis Gutierrez.
I'm Anthony Campuzano.
Hi everyone, I am Gurjot Sidhu.
So I'm going to begin the presentation by talking about the biology of valley fever. Valley fever is caused by fungus, and it is found in the southwestern portion of the United States. In the slide here, it's depicted on the bottom left in the areas shaded red. So these fungus lay dormant in thread-like structures within the soil in these areas, and it is depicted in the number 1 on the slide here. And once that soil is disrupted, the spores become aerosolized, and this is depicted in the number 2 and 3. Once aerosolized, these spores can become inhaled by humans where they settle in the lungs, depicted in number 4. Once in the lungs, these spores activate and begin to grow. Once they reach a certain size, they will burst, and then the spores will spread to different organs in the human body.
Who are at the risk? People who have weakened immune system, such as HIV, AIDS, anyone had a recent organ transplant, taking medications such as steroids or TNF inhibitors, pregnant women during their 3rd trimester. People who have diabetes may have a higher risk for severe lung infection. People who are Black or Filipino heritage are more susceptible of developing serious fungal infection. Environmental exposure. Anyone who inhales the spores that cause valley fever, such as people who live in the area where the fungi is common, especially those who spend a lot of time outdoors, such as construction workers, road workers, agriculture, ranchers, archaeologists, or military personnel on the field. Age is also one of the biggest matter. Older adults are more likely to develop valley fever. This is maybe because their immune system are less robust, or because they have other medical conditions that affect their overall health.
So some signs and symptoms of valley fever may include fever, shortness of breath, cough, blood in the sputum, fatigue, headache, night sweats, muscle aches or joint pain, or a rash on the upper body or legs. According to the CDC, many people who are actually exposed to this fungus never have symptoms. So people that get infected with this fungus can present as symptomatic or asymptomatic. Symptoms can also last a few weeks to a few months, depending on the severity, and approximately 5 to 10% of the people who get valley fever will develop long-term problems in their lungs or other parts of their body like the central nervous system, their skin, their bones, and their joints.
So moving on to diagnostics. To diagnose valley fever, your doctor will review your medical history along with your signs and symptoms of valley fever. But the doctors can order 1 or more tests, which includes like your sputum smear or culture. So basically what they will do is that they'll have the patient cough up a sputum and they would culture that to see if there's any coccidioids organisms. They will order a blood test, which basically with the blood test, your doctors will check for any antibodies that are against the fungus that causes valley fever. And then they can order chest x-rays and or CT scan to look for any pneumonia. And the invasive way that they can also diagnose would be biopsy of the affected site. So typically the lung to look for fungus in the infected tissue. But if the patients already have a history of valley fever, there is a skin test that is available that your doctor may order to determine if your body is immune to the coccidioidomycosis.
So there is no vaccine to prevent valley fever. You can try avoid areas with a lot of dust, like construction sites or open field and farms. If necessary, wear N95 mask. Stay inside during dust storms or close your windows during summer. Avoid activities that involve close contact to dirt or dust, including yard work, gardening, and digging. Use air filtrations, measure indoor. Clean skin injuries well with soap and water to reduce the chances of developing a skin infection, especially if the wound was exposed to dirt or dust. Take preventative antifungal medication if ordered by your MD.
So now for treatment for valley fever. So valley fever is considered a self-limiting condition because most patients can actually recover without any sort of treatment. Medical treatment will be prescribed if you go to your healthcare professional and they deem it as necessary, or if it seems that that your condition is severe enough. There are currently no over-the-counter medications for this. So if your symptoms are severe enough, medical treatment prescribed by your physician may be the only solution. Medical treatment includes antifungals, medications that end in azole, amphotericin B, and also providing for symptomatic relief. So antifungals that end in the azoles, these would be your fluconazole or your ketoconazole. Side effects with these medications include nausea, vomiting, diarrhea. These are just things to keep in mind if you are prescribed this medication. Healthcare professionals that are giving these medications, they should monitor your liver function tests, or they should provide for liver function tests to monitor liver enzyme levels like ALT and AST, and monitor for jaundice, because azoles do have a possibility of hepatotoxicity or liver damage. If you are prescribed amphotericin B, this medication can also this medication also has side effects of nausea, vomiting, and diarrhea. And instead of monitoring for liver damage, amphotericin B could cause kidney damage. So monitoring for that would be important as well for healthcare professionals, such as your BUN levels and your creatinine and your potassium levels. Ultimately, if you don't need or require these medications, these antifungals, you may be provided just medications for symptomatic relief. This includes acetaminophen or Tylenol for your fever, rest, hydration, and also aspirin for any muscle aches and pain.
Now I will speak a little bit about resources. So below we have outlined 4 resources that you may contact to get more information about valley fever. Included in these resources, we have found for you phone numbers, addresses, or available websites. These places or resources include the San Joaquin County Public Health Services Communicable Disease Program, California Department of Public Health, American Lung Association, and the UC Davis Health Center for Valley Fever. And in addition, the American Lung Association and the UC Davis Health Center for Valley Fever have support groups available for anybody who is suffering from this disease. So in conclusion, this brings us to the end of our presentation. And thank you for watching, and we hope you found it resourceful.